Um, what we're going to do is we're going to monitor the chat, but we're not going to necessarily worry about. We're going to spend more time with Q&A than we will paying attention to chat. So please use that if you can. And I'd like to tonight welcome a gentleman named Turner Davis. Turner is in charge of the New Horizon Infusion clinics. That's here in Tallahassee. And I'll let him kind of explain who he is and what he does. So Turner, take it away.
Yeah, hey, thanks, Mark. Appreciate that. So I'm going to go ahead and get my screen shared here just so I can get this out of the way. Make sure we don't have any issues go on here. Let's see. Okay. Yeah, so thanks for having me today. Hi, everybody. Thanks for joining us. Like Mark said, I'm Turner Davis. I'm a pharmacist and the Chief Operating Officer for New Horizon Infusion Clinics and also for Medical Marijuana Treatment Clinics of Florida. We wanted to sort of go into the ketamine infusion tonight for for mental health, for chronic pain. It's something that's really sort of starting to get a lot of attention nationally at the moment. It's been ketamine therapy, infusion therapy has been going on for depression, for chronic pain for about 10 years now. And, there's getting to be more and more studies and information about how effective this therapy really can be for a lot of chronic conditions that don't respond to normal therapy or that patients just, don't respond enough to the normal therapy to have a good quality of life. We sort of, I work with the physicians on the medical marijuana side a lot, and I've had a lot of them ask me about this over the past couple of years, about ketamine therapy, about maybe supplementing for those patients who, may be using medical cannabis, still not getting quite the results they want. Is there, as another step, or those patients that are there that may be taking, your normal antidepressants, your Zoloft, your Prozacs, and it's just not helping enough to really get them over the hump, and to really get them to where they want to be and how they want to live their life. So, just like with the medical cannabis, I looked at this and this was really interesting to me from a perspective of this was a drug that has been around, ketamine, for a long time. Ketamine is a drug that is used today in the emergency rooms and for surgery, for animals for surgery, for humans for surgery. It's really been well established as an anesthetic. It's interesting, just a little bit of history on it. It actually first synthesized in 1962. The scientists at the time were looking for an alternative to PCP. You think back, a lot of these drugs these street drugs that are being abused nowadays, actually started off with, legitimate medical purposes. They just had a lot of bad side effects, which really didn't make them good to be used medically because the side effects were too severe. And PCP, interestingly enough, was one of those. They started it, that was originally intended to be a surgical anesthetic, but obviously the side effects are just, way out of hand with it. So, they actually synthesized ketamine to find a alternative to that. It was actually FDA approved in the early 70s. It was first used with American soldiers in the Vietnam War for acute pain and for, again, anesthetic purposes for field surgery and those sorts of things. What's really unique about ketamine is that it actually has a lot of different effects. And again, I kind of relate this back to our medical cannabis. One of the unique things about medical cannabis is that it has a lot of effects on the body. And ketamine is one of those things that has a lot of different effects in the body. It's the only chemical in clinical practice right now that has hypnotic, amnesic, and analgesic effects. So, when you think about that from a anesthetic standpoint, that's really attractive for physicians and surgeons to use in those types of practice, in that type of setting, because it really does cause, several different features that you want when you're looking for a good anesthetic. But, what we're talking about today, the use that we're talking about is a little different. And it's not actually the conditions that we're talking about today, such as PTSD, major depressive disorder, generalized anxiety disorder, a lot of chronic pain syndromes. Those, ketamine is not FDA approved for those conditions. But what has been discovered really since 2006 is that ketamine can really have some profound benefit for patients that have tried other treatments and are just not responding. There was a groundbreaking paper in 2006 that first identified ketamine as a potential treatment for treatment-resistant depression, which again, what that means is depression that doesn't respond to normal treatments. And that includes medication, that includes things like electroconvulsive therapy, and those sorts of things. So patients that failed that, actually, they have found that they benefited in very high percentages from ketamine infusion therapy. So this was the first time that this paper like this was published. And since then, there's been a lot of work.
You might want to mention who JAMA is. I know as a medical professional, you know what it is. I think the average person may wonder what that is.
Right, sorry, yeah. So that's the Journal of the American Medical Association, which is sort of considered the gold standard publication for medical studies for physicians for a long, long time. So there's very difficult to be published in this particular journal. So the fact that this study got this sort of attention and continues to get this sort of attention really shows how relevant it was to practice in a lot of instances. Since 2006, again, like I mentioned, they've looked at other conditions besides major depressive disorder, PTSD, anxiety, chronic pain, specifically neuralgic pain, such as fibromyalgia, complex regional pain syndrome, things that are very difficult to treat. They actually have found benefit with ketamine. So, when we talk about ketamine for these types of conditions, what sorts of routes are available? Obviously, when we're talking about the emergency room setting, infusion is really the only way that ketamine is administered at this point. But there are several different ways that people use ketamine in the outpatient setting for depression and things. You have intramuscular injection. You actually can get a sublingual troche that you dissolve under your tongue. There's actually an FDA-approved nasal spray now, not the injection, but the ketamine nasal spray for depression that was approved about 2 or 3 years ago. It's not available just in the regular pharmacies. It's only available in certain settings, but still that was a new product that came out that did show how prevalent ketamine was for depressives in the fact that it was FDA approved for that purpose. And then, of course, your intravenous therapy. Now, the effectiveness of these routes actually vary. So intravenous is much more effective in these sorts of depression and these sorts of conditions than intramuscular injection, which is more so than the nasal spray, which is more so than sublingual. Again, a lot of that has to do with the metabolism of the drugs and how quickly they get to the bloodstream. But studies do show that intravenous therapy is the best way, the most effective way to treat these resistant conditions. Now, obviously, there's the downside of that is that's more complicated. But as we'll talk about in the presentation here, it really has become more of an outpatient procedure and something that's not all that difficult to manage, and that a lot of people have started to take advantage of, and physicians have started to offer this intravenous in-office therapy with ketamine.
And
so when we talk about ketamine,
in preparing for this webinar, there were a lot of papers and things that I wrote. People for anxiety and depression, people with PTS, people with chronic pain. I think you mentioned fibromyalgia. There's a lot of papers and there's a lot of research being done in that right now. And I think that's where you see that groundswell going on with it, because people are starting to realize that, especially a lot of doctors are beginning to realize this is something that's an effective treatment for a lot of patients.
Yeah, no, it really is. I mean, you're starting to see articles. There was about 2 weeks ago, there was an op-ed in the New York Times. Actually, a patient talked about ketamine therapy and his depression. Time magazine, news stories, these sorts of things. So it really is starting to get a lot of national attention because there's such a need out there. We all know how prevalent PTSD is at this point. I'm sure we all have family members or friends that have struggled with depression. So these are real issues that can be very difficult to treat. And the interesting thing about ketamine infusion therapy, these studies that we mentioned, that we talked about, and there are a lot of them, have shown that low doses of ketamine infused over about 1 to 4 hours can improve these conditions that are non-responsive to traditional therapy. So you use a much lower dose of ketamine in these types of therapies than you do, obviously, for anesthesia. About 25% of the anesthetic dose is used in the clinic setting for these sorts of conditions. We're not trying to knock a patient out. We're not trying to put someone completely under when we're giving these sorts of ketamine treatments. The goal is for the patient to enter a relaxed and a mild dissociative state. So when we talk about dissociative and dissociation, that means sort of a dreamlike state, sort of a waking dream where you feel like you may be out of your body, or you may be detached from your, in the case of PTSD, detached from the trauma, detached from the depression, and under medical supervision. That's a lot of times how patients describe the treatment. As the drug is being administered, they sort of, enter this dreamlike state that really is the goal of the therapy that, really kind of shows that it's working, honestly. That's sort of the goal that we're trying to get to from a clinical standpoint, from seeing the patient respond. When we talk about how well does it work, the amazing thing about ketamine in depression is it works incredibly fast. We're talking patients improve in as little as 2 hours when we start ketamine therapy, which is unlike conventional antidepressants. Conventional oral antidepressants, your SSRIs, take typically 4 to 6 weeks to reach maximum effect for patients if they're going to work at all. And the interesting thing is physicians and the folks that study these medications, they really aren't sure why that is. But the fact is, for the body to adjust to these antidepressant medications, it does take that long. But ketamine sort of goes right to, has a unique mechanism of action that the way it works is different than these oral antidepressant medications, and it has a much more direct effect. Typically, if a patient calls us and says, "Hey, I would like to use the ketamine therapy. I think I'm a good candidate. Want to learn more about it." The process is really, we assess the patient, we make sure they're a good candidate, and typically there is, for depression and PTSD, there is an induction period. So what that means is we give several injections over a short period of time to really get the body to respond to the ketamine, to sort of get the neurons and those sorts of neurochemicals, responding to the ketamine treatment. And after a period, you get 6 treatments, 1 hour infusions over 3 weeks, and then you move to a maintenance schedule of about 1 per month or as needed. So most patients, some patients that can get those first, 6 treatments, and we won't see them again for a year or 2. But for most patients, they do need a booster infusion about every 3 to 4 months to sort of, at least every 3 to 4 months, to sort of maintain that state of mind that they want. But really, even when we talk about that, when we talk about improving depression symptoms over the course of, for a period of 2 months at a time, and all we need is this infusion to kind of keep it going, it's really exciting to see these patients respond. When they've tried again, they're coming to us after they tried so many other things. Studies that really show almost 70% of treatment-resistant depressive patients will respond to ketamine therapy, and almost 80% of PTSD sufferers. So it's really remarkable how many patients respond to the ketamine therapy. Unfortunately, in that 30% if they don't respond, there's no magic dose, or we can't increase the dose or increase the frequency and make them respond. It's either patients are going to respond or they're not. But fortunately, the vast majority of patients really do respond well to the ketamine therapy, especially for depression and PTSD. They really are.
That's an important point, Turner, that the success rate has been so high. It's driving a lot of people, especially a lot of doctors, a lot of patients, to look at this as a potential option. In other words, it's one of the highest success rates that you'll see in the medical profession.
Yeah, no, exactly. Doctors that may not be familiar with the therapy, they often, when they see, how well their patients respond to these things, that's what makes them believers. That's really what makes doctors embrace a therapy is seeing their patients improve. And that takes time with these sorts of new therapies. But again, it's really kind of reaching a critical mass where it's becoming more and more first line for a lot of really severe depressive cases. We're talking about cases with suicidal ideations and those sorts of things that really, at the very severe end, that can really respond well to these sorts of treatments. Just briefly to touch on how, I mentioned that ketamine works differently than your normal antidepressants, your SSRIs and those things. It's really, again, this little diagram here really shows the complexity of how ketamine works in the body and its many different pathways that it works. But really the main way ketamine works is they work on a part of the brain and the nerve called the Nmda receptor. And what they really found interesting about this receptor is that in the brain, it is very important for memory function, to form memories in the brain. So, when we talk about, ketamine blocking the working for PTSD and depression and really separating patients from their trauma or from those things, you can see if it really affects that Nmda receptor, how that may benefit that patient, either sort of resetting those pathways that have been sort of ingrained over time, causing the PTSD, causing depression. You sort of get a break. Your neurons get a break from that stress that occurs from those things. And the antidepressive effects then, when you block those NMDA receptors, you get something called a glutamate surge in your brain, which really just sort of is a reward system. It really kind of makes your brain and your neurons respond in a positive way. And the interesting thing about ketamine as well is over these treatments, you see this word here, this synaptogenesis. That's actually what they have found with ketamine, is it actually forms new neural pathways. So when we talk about separating, the neurons from the traumatic events, it actually reroutes these neurons, forms new pathways. So your brain basically starts to skip over those parts that have been really hardwired over time to respond in one way. If you've had depression for years, your brain gets used to responding, in a depressive state. So when we talk about forming new pathways, new neural pathways in the brain, your brain is able to function in a new way. Your brain is able to function more efficiently and get around those hardwired paths that may be causing problems. So that's, it's the mechanism is not fully understood, but the more they look at it, the more complexity and really power they see behind this ketamine as a treatment to attack depression in a multifaceted way, rather than just targeting one area. This is a chart here that kind of shows, we talked about that induction phase, and you look here at the number of infusions that these letters here are different patients. And you can see here, as the number of infusions increase, the rate of response increases when we get over here to the infusion 6, which is why we use 6 infusions over 3 weeks. You're in that 70 to 80, 90% range that really have a good response to that. So that's where we, that protocol that we get is based in evidence and based in studies that have been done over time for depression and PTSD. I just wanted to play this video really quickly. It's hard to, when you're talking about a treatment, I think, especially in a treatment, the best way is to sort of listen to a patient experience and to see how, it affected them. And I thought this was a news story out of Houston. Again, a clinic there that was doing this infusion therapy, but it's a very indicative and very good example of what ketamine therapy is in real world practice.
It looks like a spa.
Alexa, play meditation music.
A place Rachel Bush has gone to unwind.
Is the music loud enough?
It's loud enough.
But this is a medical procedure where Rachel is being treated for PTSD, depression, and anxiety with an injection of ketamine.
The past few months were rough.
After an assault that nearly killed her, she was prescribed antidepressants that just didn't work.
I was contemplating suicide, wishing that I had been finished off.
Then someone told her about Dr. Quan Henderson, owner of Mindscape Ketamine and Infusion Therapy.
It helps kind of remodel the brain, the way it feels about certain things.
Ketamine affects your brain's neurotransmitter called glutamate. You can liken it to how Zoloft affects the neurotransmitter serotonin. Ketamine often gets a bad rap because of its history with people abusing it. Its street name is Special K, but it's been used in medicine for decades.
Ketamine is an anesthetic that's been around for 50 years, but in the last 15 years it's actually been used for treatment of mood disorders that are resistant to certain medications.
Dr. Henderson opened this practice after ketamine helped his wife, Stacy, who'd battled depression for years.
I couldn't believe it. It was just such a wonderful, life-changing experience for me.
KHOU's mental health and wellness expert Bill Prasad warns ketamine has addictive properties, although it's on the lower end of the spectrum. He says ketamine should be used sparingly and hand in hand with therapy. The FDA has not approved injecting ketamine for mood disorders, but the VA hospital does use it to treat PTSD and reports positive and immediate outcomes.
This is a miracle medicine.
Rachel says it worked on day one for her and describes the experience like this.
It's almost like I'm slipping away into a good dream. And things just start to make sense. Something changes. You see that you're not in crisis mode. You see the light.
Dr. Henderson says the effects can last months to years, depending on the person.
In my opinion, it's a cure for depression and PTSD.
So that was a good example of a patient, who's really responded well to the ketamine therapy. And we do hear that, a lot. The articles you read, the outcomes that you get, that is not atypical. Patients really do respond very well in a lot of cases to the ketamine therapy. It really, I think the biggest variation for people is how long it lasts, how long the effect lasts. Will it last a month? Will it last 3 or 4 months? That's really where the variation comes in for patients with this treatment-resistant depression and PTSD is long-term. How long will the therapy last for them? But there's certainly in the almost, again, 80, 90% in the short term, definitely a significant advantage with patients. So when we talked about the mental health conditions, chronic pain is something else that ketamine can also treat. The evidence isn't quite as strong with chronic pain. There's about a 50 to 60% response rate rather than an 80 to 90% response rate. And most patients, it's not going to cure their pain, but what it does is it can make it much more tolerable, much easier to deal with, than on a day-to-day basis. And again, when we talk about, the ultimate outcomes or ultimate goals of reducing opiate use or reducing other medications that are causing, really negative side effects, those are things that can be done with ketamine therapy, as an adjunctive or an add-on therapy for chronic pain conditions. Neuropathic pain conditions definitely respond at a much higher rate than inflammatory pain types. Again, because ketamine is mainly works on the central nervous system, not so much on the inflammatory. Although it does have an anti-inflammatory component, it is mainly works on targeting pain signals. But that can really include a lot of difficult to treat conditions, again, like complex regional pain syndrome, fibromyalgia, migraine headaches, neuropathy, cancer, chemotherapy neuropathy, has been treated. Lyme's disease is something that a lot of patients come in to get treatment for. So those sorts of things can really benefit from ketamine therapy. What the studies show is that the effect size is relatively large. How long the treatment persists, is really, again, very individualized. The protocol is different for the induction phase on a chronic pain patient. So after the assessment, a physician will administer 3 2-hour infusions over 7 to 10 days. So the time of the infusion is longer, 1 hour for mental health as opposed to 2 hours for chronic pain. Because you want to expose those nerves longer to the medication than you do with, it just takes longer for those peripheral nerves and those pathways to react from a pain perspective than it does from a mental health perspective. And then after that, it's sort of an as-needed basis. Patients will come in. Most patients, usually get in one infusion every 4 to 6 weeks, but some can last as long as 1 to 3 months for the chronic pain. Again, it's really based on patient response and how they feel, their pain is being controlled at that point.
I should one of the questions we have is someone asked about the articles are hard to read. All the articles that we cite, you'll be getting a follow-up email from us that has a copy of the video, copy of the presentation, and then it'll have all the notes, which includes all the articles and citations, so you can see them. That's what I pointed out. You know.
Yeah, absolutely. Yeah, it's difficult to get a good legible citation on these PowerPoints, especially online. But yeah, we'll definitely make that available to everyone. There's a lot of information out there. I can tell you, just Googling ketamine therapy depression, you'll get a lot of medical journal articles. There's just been a ton of work done over the past few years. Again, when we talk about blocking pain, just a brief mechanism of action here for pain. Again, it goes back to those Nmda receptors. And again, we're talking about resetting the pain receptors, resetting the neural pathways to make them respond differently after the treatment that they did before. So it's not just a short-term, I feel better, I took the medication, it's affecting it while it's in my body. Really the goal here is to sort of remodel some of these neural pathways to get your body to react differently to those pain signals. One thing that ketamine does do that, that other chart showed as well is increased brain-derived neurotrophic factor, which again, when we talk about synaptogenesis, neurogenesis, growing new neural pathways, that BDNF is key, and that neuroplasticity is what they call it. The ability of your nerves to heal and to remodel themselves really is important. One other aspect of this, what's interesting, and this works, I think, for both pain and for the mental health conditions, is that it inhibit the activity of the default mode network. So basically what that means is the way your brain behaves when you're resting. A lot of patients with chronic pain, with PTSD, with depression, when they're at rest, laying down at night, that's when their mind is really racing. They're having a hard time, getting their mind and thoughts under control. And ketamine can actually help to reset this default mode that the patient's mind experience at rest, with that. And that's a big part of their response, again, and it goes into being able to rest, being able to relax, being able to reduce your stress levels over time. So yeah, it's just, again, a very multi-factored effect that ketamine has in the body, which is really, interesting. The more they dig into it, the more they really learn. So when you talk about, and this is really sort of the standard, this is how it works at our ketamine clinic here in Tallahassee. Also how it really works at most ketamine clinics across the country. We traveled and worked with several clinics around the country when we're developing our protocols, and this seems to be sort of a standard model of how this works. You would contact the clinic for an initial assessment. You would want to, either the clinic can help assist you obtain your medical records, or you can provide your medical records to the physician. He'll review them to make sure you're an appropriate candidate for ketamine therapy. On the day of the appointment, you're going to want to hold your medications and food for medications for as long, at least 24 hours if you can. No food for 4 hours before. As you saw in that video that we watched, you want to bring some music, your own, typically our patients will bring their own music or anything to relax. You don't watch TV or anything like that, because you want to really, focus on, reaching that dissociative state, but music can help patients really do that. After the infusion, whether it's an hour or 2 hours, the physician will observe the patient for 20 to 30 minutes. And really, one of the big things the patients have a hard time with sometimes, transportation is important. Obviously this is just like a surgical procedure, and the fact that you can't drive for 24 hours after it's not a good idea to drive for at least 24 hours after you get a ketamine infusion. But certainly, at least when you're leaving the clinic, the physician's going to want to have somebody there to, you're going to want to have somebody there to drive you home, obviously, because it does take a couple hours to fully get that your mind reset after getting that ketamine infusion.
So really, when you do this, you need to plan it. It's an appointment, just like a regular medical procedure.
Exactly, it's a day. It's going to take you. You want to take a full, plan on, or at least, if you're taking having a late afternoon treatment, at least half a day, to make sure you have some help and some driving help there. So, that's the down, there's advantages and disadvantages of every therapy. Certainly, the infusion is a little more cumbersome, but again, this is, you're really only talking 6 infusions over 3 weeks, and then maybe once every month or two. So it's cumbersome in the beginning, but then for a lot of patients, really they don't have to come in all that often. So it's not a big burden on them after that initial those initial induction phase of the infusions. Side effects patients have from ketamine therapy, definitely number one is nausea. A lot of patients will receive a anti-nausea medication during the treatment. We give our patients a couple of doses of Zofran to go home with in case they experience some nausea. But, you know, it's probably 50-50 patients experience nausea with ketamine. Some patients may have elevated blood pressure during the treatment. That's something we monitor and treat during the treatment. You know, obviously hallucinations, excessive sedation is a risk. And then certain medications can conflict with ketamine. So if you're taking Lamictal, benzodiazepines, naloxone, all of those can block the effect of ketamine. So that's why it's important, if you can, to try to hold some of those medications before you do the treatment. So the good thing is that ketamine only has a half-life of 5, you know, intravenous ketamine has a half-life of 5 minutes. So, you know, that's why you're able to do this on an outpatient basis, because it really doesn't stay in your system very long. You know, it has the effect while you're getting the infusion. It immediately the effect starts to wear off right when you stop the infusion. So as far as, you know, increased blood pressure and those sorts of things, that's really only something to worry about while you're getting the infusion, while you're being medically supervised. So there's not much risk there. Cost is definitely something that is a barrier to some patients on this. It's not FDA approved for these conditions. Ketamine is not. So most insurances still won't cover FDA for depression or chronic pain use as an infusion. You know, this is slowly changing. We do see some insurance carriers have started to reimburse for this therapy, but it's very few still. And certainly all private insurance that if they do it. Typical cost per infusion for depression or PTSD treatment, that would be a 1-hour treatment. The range is anywhere from $350 to $600 for pain, which is the 2 to 4 hour treatment, anywhere from $500 to $800 per infusion. So for that induction phase, you know, you're talking somewhere, you know, between $1,600 to $3,600. For pain, you're talking somewhere between $1,500 to $2,400 typically for the induction phase, and then just sort of an as needed after that. Most clinics will provide, you know, some sort of financing if it's too big of a barrier, but it is typically a cash, a cash service for most patients. Now we do, you know, in most clinics, we'll work with the patient, provide them a bill to work with their insurance company. If it will be reimbursed, you know, the insurance company may pay the patient back after they pay the clinic, but that is something that is not guaranteed by any stretch on that. It's still difficult to do. You know, as far as our clinic goes, and then really, you know, I say this, we looked at several different models around the country, and you know, what we really found is that in the news story mentioned this, you know, really having a therapist available to work with the patients, especially on the mental health side, really improves the outcomes of ketamine therapy. So we really follow our patients to see how they're responding along the way, and we have our therapist on staff reach out to the patient to really just talk with them, you know, talk through any concerns or feelings they're having, and you know, make that available if the patient wants to continue after. You know, that therapist can continue after the infusion part is over, and because that is a key component of obtaining the best outcomes. You know, a lot of clinics will just, you go in, you get the infusion, you go home. We really want to make sure you're supported, and most good clinics do that. You know, I think there's several different models out there, but I think the most effective is really having that therapy available, that talk therapy available for patients. We're physician supervised.
Really one where it's not a matter of just getting the treatment and see you later. This is something that you do follow up on, and it's an intimate relationship between the clinic and the patient.
Exactly. It's really more of a program than just a service. You know, we really, with our particular patient care software, we actually have an app that you download that will, you know, ask you to fill out a mood score, you know, every couple of days, that our therapist can see how you're responding. If you're having an issue, she can actually contact you and say, hey, you know, I see your mood score kind of dropped. Is there, you know, you want to talk about it? How are you feeling? Those sorts of things. And that's important. It's important for, you know, patients to feel like they're supported and to really achieve the best outcome there. Physician supervised is something else that, you know, different models out there. Some clinics use ARNPs or PAs. Nothing wrong with that, but for a lot of patients, they're just more comfortable with a physician on site. And because our clinics are usually side by side with our MMTC medical cannabis clinics, there's a doctor on site to work with you during your infusions on that. So that's important. Right now, we only, as far as New Horizon goes, our Tallahassee location is our first clinic. We do plan on rolling out more across the state over the next year or two, as our patient base increases and as the need increases for that. So, with that, I'll end it. Appreciate everybody's
Hold on,
attention on this. I think
we got a few questions. Why don't we dig into those?
Oh yeah, no, absolutely. No, absolutely. Yeah, I just wanted to, before we get into the questions, want to thank everybody's attention and just say, this is something new that I didn't know a lot about, a couple of months ago, but the more I've learned about it and I've seen patients really respond, it's been exciting and it's something that, we really look forward to rolling out everywhere. So.
Sure. So let's take a look here for a second. There's one of the questions. I don't know. Can you see the questions that are here? It says, is ketamine a drug means prescribed? Do you get it in a pain management clinics and regular doctors, or is it more like an herb or more like, that is more readily available? So
ketamine, it's an FDA approved drug. It's a normal medication, that has been around for quite a while. Most of these ketamine clinics, there are some pain physicians that will do ketamine infusions. It's not well established here in Florida. In other parts of the country, out west, up in the Northeast, there are a lot more options for ketamine infusions, but it's not something that's really been widely adopted in the Southeast and in Florida specifically yet. So most physicians really aren't set up to do it. When you see that, the difficult part for physicians is that we talked about that 1 hour infusion or 1 to 2 hour infusions. That's difficult for a normal physician to manage because, they just don't have the time to monitor someone for that long. So, that's again, while sort of these specialty clinics are popping up, they're really focusing on just providing this service to patients. A lot of times physicians will refer out to these ketamine clinics again for that same reason. Because they don't have the hour or 2 hours to spend, with a patient doing that infusion or the room or space available to do it. So, having, the room set up, again, that spa-like setting, the relaxing setting where the patient can come in, sit in a comfortable chair for an hour or 2 hours in a quiet space is really all important. All of that is important to having a good outcome with the ketamine therapy. So yes, although most physicians could do it, it's a widely available drug. It's just the logistics of doing it really makes it more of a specialized service.
Cool. Now, Daniel, can you see the questions? Or you want me to read them for you?
I do not have the questions up here.
Okay. It says, when used as migraine treatments, how long do the benefits last and what side effects are common?
So with migraine, the protocol is the same as we talked about for the chronic pain treatments. You would get those 3 infusion induction series. And again, it varies from patient to patient. But most patients have, for those patients, we see for migraine patients that get those types of treatment, they usually have 15 or more migraine days per month. And, our goal here is to really knock that down to a much more manageable level, from 15 headache days to maybe 7 to 5 or something like that. It really becomes more of a preventative thing for the migraine headaches. As far as the side effects are the same, your side effect profile is the same as with any other treatment when you're treating ketamine therapy, but it's very individualized as far as the response the patients get from it. But overall, reducing the number of headache days for migraine patients is the ultimate goal with the ketamine therapy. And it is, again, there are several studies out there that have started to really look at that as more and more of a first-line treatment for severe cases, for sure. They are seeing a lot of benefit there. So
now, you mentioned the side effects. I think you'd mentioned that during your presentation for migraines. What side effects should they worry about?
Yeah, so again, most of these occur during the treatment, and again, nausea being the number one, and we do, medicate patients, give them some Zofran during the treatment to minimize that nausea. But after the fact, side effects after the treatment, you really don't have any because that drug doesn't stay in your system very long. The only question is, is it working for you or is it not once you get out of that treatment chair? So,
cool. Nancy asked the question, says, how, do you know if this is still, if it is still beneficial for patients with COMT++ gene mutation?
Yeah, I'll be honest, I haven't looked into the metabolism piece of that and those genetic metabolic issues like that. It's something I can look at. I honestly don't know the question to that, to be honest with you, but it's something I can get back to her on. Yeah. I don't want to give her a bad answer on that, but it's something I can definitely look
Nancy,
at.
we'll get back
I know with the infusion that you get around a lot of those metabolic issues because you're going directly into the bloodstream. So it in the half-life of the ketamine being so short, shouldn't be a big concern. But again, that's something I can double check on. So.
Elaine asked a great question. Is it okay for diabetics?
Yeah, no, perfectly fine for diabetics. Diabetic neuropathy is something that can certainly respond well to it. Doesn't cause any increase in blood sugar. Blood pressure is just something. If you're running high, a lot of diabetics have comorbidity with high blood pressure, hypertension. That would be really the only thing to be concerned about if you had that. But the diabetes itself, it's not a concern.
Sure. One other question, Barbara asked a great question. It says, my daughter has a nurse come to her home for 3-hour infusions for her Crohn's. Why can't a nurse do the same for ketamine?
They could, yeah. But there are services out there that will provide home ketamine infusions for sure. They're just the monitoring at home. You do have to have, you do want your patient on a blood pressure monitor and a pulse ox monitor while they're getting therapy. But that's not hard to do in the home either. If I were her, something she could definitely talk to her physician about. It would be a pretty simple thing to do, honestly, if you're already getting those infusions at home. So,
yeah, you're not offering that service right now, but it may be something coming.
We don't. We don't ourselves, just again because of the monitoring limitations, that we're not really set up to do it. But home health could certainly, that's something they would have to work with their primary doctor on. But it's something home health could certainly do. Absolutely. Yeah.
Sure. Great. Well, we've knocked off a lot of the questions, Turner. So you had one question that did come up. You talked about new clinics coming up. You're planning those over the next year or so. You're going to be opening up new clinics.
Yeah. Yep. More than likely, Panama City will be the next one, and then probably somewhere on the southwest coast down there. We've got a physician that really is wanting to get going down there as well. So we're kind of letting physicians dictate where they want to start. But yeah, no, absolutely. Got several more rolling out. So
they're coming. Well, cool. Well, listen, this has been very informative. I know I've learned a lot. Do you have any closing comments that you want to go over?
No. I just again appreciate everybody's time, and if I just stress if you have a relative or loved one that's really struggling with these types of conditions, I know again, like I mentioned, cost is certainly a barrier because you're having to pay for this provider time for an hour or two. But again, short-term cost really, and a lot of patients have long-term benefit from it. So it is something that really maybe something that may be a good option for folks. So
sure. I mean, there's a reason why this is becoming more popular and why you're hearing more about it, and it's because it's effective.
Exactly.
And there's a lot of people that are starting to use it. And I think our government, our system for being able to follow up on effective treatments is a little lagging in many cases, and that's what you're seeing in this case.
Well, for mental health especially, America is very bad at taking care of our mental health issues, and I think anytime you have a very effective therapy out there, it's definitely worth taking a look at. So. Yeah,
and I think again, it's especially in, I know I've dealt with some cases of PTS and things like that. It's a very effective treatment. Not to mention, I'm not familiar with ketamine as I am in medical cannabis, but I do know that chronic pain and just pain in general is something that a lot of people worry about.
Exactly.
Well, I'd like to thank everyone for attending the webinar. I'd like to thank you, Turner, for spending the time. It's been informative. This is the last webinar in our spring webinar series for the medical marijuana and wellness webinars. I will mention again, you'll be getting an email following up this webinar that will have a copy of the video, a copy of the presentation, and all the notes, the citations and things will be in there, plus a link to the new Infusion clinics, New Horizon, Infusion clinics. So it's something that we will be able to get there. And naturally, you have our emails, so please feel free to let us know about the last one there. Now, I will mention that we're going to kick off kind of a summer program for the Medical Marijuana and Wellness Seminar Series. We're going to be having a webinar on the 21st of July. It'll be on dosing, medical marijuana and dosing. That's always a very popular subject and one that's interesting for a lot of people. And I think, Turner, you're going to be doing that for that one. Is that correct?
Yes, I think that's correct.
Now you're on the menu for that one, so join us. But please join us for the dosing webinar that's coming up. And we will, for those of you that follow our webinar series, we will be announcing a whole schedule for the summer. And actually, we're going to be announcing a schedule for the rest of the year. It'll be done in the next week or so. So with the holidays and the wrap up of this seminar series, we're kind of replanning for the rest of the year. And things are beginning to open up a little bit. So we're kind of looking at some new topics. I know coming up in the new series, there'll be subjects like sleep and medical marijuana. So we're going to be taking on some new subjects. There is a survey on our website, Marijuana Aware. Please take it. We'd like to hear from you. And if there's some subjects that you'd like to have us discuss, please let us know. So Turner, thank you very much for your time. More importantly, for everyone who attended, thank you for attending. We much appreciate it. And please join us for dosing. That'll be in again, July 21st. And look forward to we'll be sending you out, and please join us for our webinar series coming up in the future. So thank you, everyone.
Thanks, Marc.
Have not only a good evening, but have a good 4th of July weekend. We look forward to seeing you next quarter. Thank you.